Hi, my name is Dhruv Arora.
And my name's Aditya Benkodi.
Today we're going to present Asclepion.
All right, so we kind of wanted to go off of the rationale that doctors have to go through a lot of intensive medical training to reach to the point where they're at. And oftentimes, with such high volume of patients and so much patient data, it's a lot of workload, and we want to kind of reduce some of that workload and cognitive stress that these doctors face by utilizing some locally hosted LLMs to kind of supplement, not exactly replace, but it supplements clinical decision.
So at the beginning of this hackathon, we actually had the opportunity to speak with a doctor, and we kind of asked them for their day-to-day and what are the biggest challenges that they face. And something that they really did talk about was documentation and how that's a really big factor in why doctors will burn out. And that's a lot of the work that they have to do, especially when they're not even treating patients or talking to them. They're spending a lot of time working through that documentation.
So we want to go on to our main part of the app, which is the flow section. So on the left side, you'll see we have patient notes, which contains all of the possible notes. We can copy and paste our own notes. In this case, we have a preset up. We have the clinical reasoning, which is on the graph. We can actually import and export previously loaded graphs, and we have the option to basically change the heat maps. If you go up there, you can see that the most likely cause of this, which is the diagnosis, will be red. And when you switch it to the heat map effect, the basically symptoms, the more green they are means they're most likely not the contributing factor, and the more red they are means that they're the contributing factor. We also have the option to add symptoms and add diagnosis made by the doctor. As you can see, this is currently querying the backend. We have a large language model running off of Ollama right now that's responding. It's going to be a little slow, but give it a few seconds.
This usually takes around a minute. So while this process will run, we'll kind of go over the rest of this. So the purpose of this flow is that we're able to create visualizations for doctor's notes to make it a lot more easy for patients, let's say, to understand their doctor's notes, or even insurance employees to help understand what was the doctor's thought process when they were helping this patient out, and what was the reason for perhaps a certain test. So this entire visualization just helps facilitate the communication of ideas. Cool. And we're going to continue with this the analyzation, because the Ollama model takes a little bit. But another addition that we had when we were actually working through this is we came across a couple challenges, which was the optimization of the model, making sure it was quick while also balancing how much balancing how accurate it was. And we ended up actually using the Med Gamma model because it has a lot of fine tuning specifically towards the medicine related side. And in addition to all of that, it was also very quick. You can see here that the tokens are being produced on this computer at around 150 tokens per second. But in addition, when we were going through this, we also found that if we are able to use a much more powerful model in the future going forward, this would make the entire process a lot more accurate and a lot more helpful for people because it would be a lot more descriptive.
Yeah, like I was saying, here's the heat map cause, here's the heat map effect. We do have the option to confirm a diagnosis. As you'll see, there are some things going against and contributing to. We can actually, first of all, let's remove the rash. We can delete this node, and it's now completely gone off of the graph. And if you want to say that, yes, this is the diagnosis, let's go with this one, infectious mononucleus, we can confirm this diagnosis, and it hides all of the other ones. Furthermore, you can always highlight certain things to get a better understanding of what they do.
Now, kind of going over the billing side of things. So the billing actually syncs with the patient notes from the flow. So everything is connected here. This is a cached bill that was previous for a different case study. So now I'm going to just generate a new bill. And what this does, it actually uses another LLM. This is going to use Maestro Nemo instead of MedGamma. And what this will do is it will actually go through the patient notes, and it will determine what were some of the items that the doctor had actually ordered for the patient, such as an X-ray, MRI, etc. And what we're doing right now is we're accumulating all of those results, and we're creating a entire array of them. You can see here Maestro is kind of creating that array right now. And then it will concatenate those and build it into a PDF that will be a full entire bill. You can see here, it also includes the level of service And hopefully in the future we can also add a more realistic level of service calculator from already established ones. And the purpose of this is now if we move into the insurance page, we can actually use the billing estimate to kind of see all of the billing, and then this is supposed to be helpful for insurance. If you want to go over that.
Yeah, so a little bit more about this is that this rates all procedures from the billing page out of 10, so how relevant it is to the current diagnosis. If we want to say that we want to do an analysis on strep throat, it's probably going to rate a blood culture on the lowest. Meanwhile, for infectious mononucleosis, it rates it relatively high. So you'll notice this is significantly faster than the other pages. It's because we've trained our own model through PyTorch. As you can see, we have a PyTorch model running right here on Python, and it is directly, the front end, it is directly querying this. And to talk a little bit more about the backend in specific, we opted to stay all local because using or relying on third-party apps for such sensitive patient information, although might be cheaper, is a liability in terms of security. Say if these models utilized our data to continue to train or stored these, cached these in any way, it would be a HIPAA violation and violate the patient security. A little bit more about the parameters. In terms of Gemma, this is a Google fine-tuned model with 4 billion parameters, and the Maestro Nemo is at 12 billion parameters.
Cool. Well, thank you for taking the time to really look at our application, and yeah.
Thank you.